Let's talk for a minute about the overall process and timing of dental implant placement. Dental implant placement is going to start with either extraction of a tooth, or if in some cases the tooth's already been extracted. If a tooth is present, the first thing that needs to happen is we need to extract the tooth and evaluate the site. Many times we can extract the tooth and place an implant on the same day. If not, it may require up to 3 to 4 months of healing after the dental extraction for an implant to be placed. Once all bone grafting has been completed and the site is adequate for implant placement, an implant typically needs to heal for 3 to 4 months before a crown can be placed upon that implant. In individual situations, we can place temporary cosmetic crowns on certain teeth to aid in the aesthetic and functional characteristics of the patient. This is not necessarily appropriate for every patient, and again, it's done on an individualized basis. Typically, after the 3 to 4 months of healing has been completed, an implant will then move on to the restorative phase. As the surgeon, my job is to get the soft tissues, or the gums, ready to be impressed so that a crown can be fabricated. At which point in time I send you off to the general dentist to have the crown made. The overall process of implant placement will typically take anywhere from 3 to 4 months if all that is needed is an implant, all the way up to 6 to 8 months if bone grafting was required first. We will cover the individual necessities that you would have in any consultation visits.